According to the Beijing headquarters for COVID-19 response working plan, we are organizing the 140th press conference. We will give you the latest updates about Beijing's COVID-19 situation, review the information, and also take your questions. On the 2nd of July, we have 2 new domestically transmitted cases, 1 new suspected case, and 1 asymptomatic case. We have newly discharged 3 cases since the 11th of 6th. After the outbreak of the cluster of Xinfadi wholesale market, we have accumulative 331 confirmed cases, among which 324 still hospitalized. We have cured and discharged 7 cases. Still 29 asymptomatic cases are under medical observation. For 5 days in a row, we have a single-digit, nearly daily reported confirmed cases. And the recovery rate is on the rise. The fight against the COVID-19 remains the top priority for Beijing, capital city, and Beijing headquarters for COVID-19 response during its 73rd conference has stressed that we have stabilized the prevention and control of the disease. However, we're still facing a complicated situation. We're at a critical moment, and we should continue to consider the prevention and control as our top priority. We have to fight against the domestic and imported cases, have an accountability system, and pay attention to key areas, key environment, key populations. And we have to base our approaches on sciences and technologies and continue with our efforts of prevention and control. For the key areas, we have to strengthen our efforts for COVID-19. For Fengcai and Daxing, where the risk is very high in certain regions, we have to rearrange the total environment to improve our system of prevention and control, strengthen the management on the basis of the communities, especially for those areas and suburb regions that are in close connection with Xinfadi wholesale market. We have to ask people to stay at home for the quarantine period and also have the disinfection measures in place. For key environments, we also have to strengthen our measures. We have to continue to disinfect and rearrange the Xinfadi wholesale market, keep up with the following up measures with the other wholesale markets, grocery products market, and agro-products market, and also to trace back through every link to the whole supply chain. For the construction fields, we have to carry out investigations, and for the units of work in charge, we have to ask them to mobilize their workers to start the measures of inspection. We also have to disinfect the total number of the public toilets and prepare for the coming Gaokao, the entrance exam for universities. In the classrooms for the exams, we have to prepare a good environment, for example, with the air conditionings to create a better condition for the students taking exams. For the personnel working in Xinfadi wholesale market will have the close contact. They are the key populations. We have more than 100,000 community workers and volunteers knocking at door of people in question, and we are carrying out the sweeping actions to find out those suspected persons and ask those people to stay at home for quarantine. For the people that have developed the symptoms, they will be transferred to the hospitals for further cure. For all the people that should be tested, we will give them access to the testing so that we could conclude all the people that should be concluded. For people that have visited the Xinfadi wholesale market, we have to prolong their medical observation duration and also give them psychological assistance. For those people getting out of the period of medical observation, they have to keep a close eye on their health status and form a closed loop. We also have to strengthen our efforts in the epidemiological survey For all those people that should be put into quarantine should be following certain rules. And also we have to standardize the management for the key environment, key populations, for people trying to cover their past trajectories, and those people not showing due respect to the rules. They have to shoulder their responsibility or they could be punished. And for those breaking the law will be certainly punished. Today we have invited representatives from the Beijing headquarters for COVID-19 response, the Beijing Public Security Bureau, Beijing CDC, Fengtai District Government, Xinfadi District Government, as well as the National CDC to participate in our press conference. They will share with you the latest information. Now, please allow me to introduce the speakers to you. Deputy Group Leader of Testing of Beijing Headquarters for COVID-19 Response and Deputy DG of Beijing Municipal Party Committee Organization Department Zhang Qiang, Deputy DG and Spokesperson of Beijing Public Security Bureau Pan Xuhong, Permanent Member of Fengtai Party Committee and Permanent Deputy DG of Fengtai District Government Zhou Xingchun, Deputy DG of Shijingshan District Government Zuo Xiaobing, Deputy DG of Beijing CDC Pang Xinhuo, Member of the NHC Expert Team, and Deputy DG of the Emergency Center of the National CDC Shi Guoqing. First of all, I'd like to give the floor to Madam Pang Xinhuo, Deputy DG of the Beijing CDC, to give us the latest information about the newly reported cases. Friends of the media, good afternoon. Now I'd like to brief you the details about the newly confirmed cases on the 2nd of July. From 0 to 24 o'clock, 2nd of July, we have reported 2 new confirmed cases. Now I'd like to brief you the details. Case 1, female, 56 years old, living in Fengtai District, Xinchun Street, Fujing residence, a retired person. On the 3rd of June, she has visited Xinfadi wholesale market underground for the shopping of meat and mutton, beef and mutton. Then she was recognized as a COVID-19 suspected case. On the 29th, she developed further symptoms as coughing and fever, and on the 30th, she's been transferred to the hospital, and on the 1st of July, she's tested positive on the 2nd, confirmed as a COVID-19. Case 2, female, 32 years old, living in Huaxiang of Fengtai District in Guogongzhuang. She's the owner of online shop. She developed symptoms like the fever, and later her husband drove her to the hospital. On the 14th of June and until the 21st of June, she stayed at home. On the 22nd of June, her daughter and her have been confirmed as a close contact of a confirmed case, and later she's been transferred to the centralized quarantine area, and she's tested positive in the NAT and later transported by ambulance to the Fengtai designated hospital. On the 2nd of July, she's been confirmed as a COVID-19 case. And now I'd like to talk about one case, about asymptomatic case. Asymptomatic case, 24 years old, living in Tiancun Street, 35 courtyards from Haidian District. On the 5th of June, she came back to Beijing from Chongqing. On the 4th of June, she went to wholesale market of Xinfadi. On the 15th, she tested negative in NAT. On the 16th of June, she went to the hospital due to the misbirth. and later she came back home for the home-based quarantine. On the 18th, she developed symptoms like fever and transported to hospital by ambulance. On the 19th of June, she's tested negative for NAT. After the cure, she went back home for the home-based quarantine. And she has broken the facilities set at the doorstep in order to force her way out. And she also visited a hospital for children and maternity. Later, on the 29th of June, she reached the deadline for her home-based quarantine. On the 30th of June, she participated in an NAT at village level, and on the 1st of July, she went to a hospital for another round of NAT. And on the 2nd of July, she went to a shopping center. She has visited a hair salon and a noodle restaurant. At noon, she received a call and knew that she's been confirmed as a COVID-19 case. Upon this news, the Xinfadi district has sent an ambulance to transfer this patient to the hospital, and she's been diagnosed as an asymptomatic case, and in the evening she's been transported to Ditan Hospital. Until now, we have traced 204 close contacts of this asymptomatic case. All of them are put into quarantine, and we are also keeping up with the other following measures. This is the relevant information about this asymptomatic case. Here, once again, I'd like to spread an information for people under quarantine. Please respect the rules for quarantine. It is forbidden for you to go out of your room to visit other family members or your neighbors, and if you have any symptoms, you don't feel very well, please inform the authorities. For all the citizens, please take care of yourself. Please refuse to participate in any massive gatherings, and please follow the rules of the community-based management. After taking the NAT, before getting the confirmed results, please stay at home and try to avoid any further contacts with the others. For the other clinics and medical institutions, if you have received patients with similar symptoms, please ask for their epidemiological trajectory. If you have discovered any problems, please follow the routine and transfer the patient accordingly. And for all the patients, they should collaborate with the institutions and authorities. You have to shoulder your responsibility. If you try to cover your trajectory or hide your personal information, you will be held accountable, and you will pay the price. Thank you, Madam Pang Xinhuo, for your briefing. Now I'd like to give the floor to Deputy DG of Xinfadi District Government, Zuo Xiaobing, to talk about the Wanda Plaza case with that asymptomatic case. Good afternoon. On the 2nd of July, we have received a report that there is an asymptomatic case wandering in the Wanda Plaza. We have immediately launched measures of emergency response. Together with the Public Security Bureau, immediately we went to that plaza in order to have a management of the situation. Currently, we'd like to brief you our measures. First of all, we have immediately organized the utilization of a negative pressure ambulance to send this asymptomatic case to designated hospital, and we have started epidemiological survey. In the same day, in the evening, we have transferred further this case to Ditan Hospital. Second, for the trajectory of this case in the Wanda Plaza, we have started the trajectory tracing For 47 direct contacts, we have moved them to the concentration area, and also we have continued with the tracing and screening. For the general contacts, we will ask them to carry out a general observation measures, and we have tested them for NAT, and they tested negative. We have also taken 185 environment samples, all tested negative. Number 4, according to the prevention and control management, we have locked down the whole plaza. For all the entries and exits, we ask them to register themselves. After the registration, they could leave the place, and we have also started the disinfection and observation of the environment. For all the workers inside the plaza, they have to follow the rules for the testing. If we have all the negative results, we could reopen the plaza as soon as possible. Number 5, we have communicated with relevant authorities and the CDC. We will share the information with other districts too. Thank you. Thank you, Mr. Zhuo Xiaobing, Deputy DG of the Shijingshan District Government. Now I'd like to give the floor to Deputy Group Leader of Testing of Beijing Headquarters for COVID-19 Response and Deputy DG of Beijing Municipal Government Committee Organization Department, Zhang Qiang. Good afternoon, friends of the media. After the outbreak of Xinfadi wholesale market, we have decided to have an early discovery and early screening, as well as early cure and treatment. In 4 batches, we have carried out NAT for key populations, key areas, key sectors, and key environments. As of 24 o'clock, the 2nd of July, we have completed 10.4 million samples taking. Now we have 331 accumulative confirmed cases. 52% of the confirmed cases are diagnosed after being tested positive in NAT. NAT is a very effective way to curb the further spreading of the virus. It is playing a very crucial role. First of all, we have put the focus on the key population. According to the epidemiological survey of the first discovered patient, we have immediately narrowed down the scope of the targets. As of the 16th of June, for Fengtai District, Xinfadi, as well as the Yuquandong Market from the Haidian District, as well as the other nearby residents. And we have also taken samples from the other people seized by the big data, and also people voluntarily reported their own cases. We have tested 578,000 people. After being negative, they still have to follow a 14-day of at-home quarantine and then have a second round of NAT. Second, we have the whole society screening. After making the sampling and screening of NAT for the key populations, we have also tested people living in medium and high-risk areas and residences. As of 28th of June, we have completed the NAT for key areas workers like the delivery men, restoration, community workers, banking workers, and workers in the hair salons. In the high-risk and medium-risk regions, we have completed the task of NAT. We have in total tested 7.4 million people. And we have entered the phase 2 since the 28th of June. All the people that should be tested will be tested, and people that have a willingness to be tested could also participate. This is a very large scale of social NAT. This has further curbed the spread of the COVID-19 virus. This has helped to stabilize the mentality of the people and thus stabilized whole society. Number 3, we have stabilized the current stability of testing from 75 to more than 170 organizations capable of doing the NAT. Now it's being stabilized at 458,000 samples per day, and the maximum could reach 1.08 million. With the throat swab, it could the stockage reached 2.28 million, and the daily capacity of processing of medical sewages and wastes reached to more than 125 tons per day. We have also mobilized more than 500,000 people, including the volunteers and community-level workers. On a daily basis, we have more than 400 places for the NAT, and we have mobilized more than 7,000 medics for the daily testing. And the maximum daily testing capacity is for 1.21 million samples. And fourth, we have improved the capacity for the NAT. All the people that should be tested will be tested. By doing that, we have stabilized the situation in the society, especially in the medium and high-risk areas. This could also make our measures for prevention and control more effective. We will continue to apply these measures for the NAT, so finally we could reach a good result to bring this confirmed cases number back to 0. Based on the population number of each district, we could have an adjustment of the existing NAT test organizations. For CBD and other key areas, we could have ambulance facilities for the test. We could also set up small scale of makeshift organizations for the test. We should also have the obstacle-free appointment platforms for NAT. You could have access to the NAT by the appointment online or by a phone call. Usually, after making the appointment, you could have the access to NAT within 24 hours. And after the test, you could also use multiple channels to reach to your results. We have to combine the information technology in order to facilitate people's consultation for information. This time's NAT is a big challenge. However, we have braved the difficulties, and we have mobilized the community workers and policemen, as well as other workers from the authorities, together with the medics from different institutions for medical care and also private organizations. Altogether, we have formed a synergy. The NHC has also mobilized 26 provinces, which have sent their volunteer doctors and medics to Beijing, carrying facilities with them. They have helped to test 500,000 samples. Altogether, we have followed a very good routine of the test. And here I also would like to say thank you to all the citizens and residents in Beijing for your collaboration. Still, a tip for you all: we are at a critical moment for fighting against the COVID-19. The completion of the nucleic acid test is not the final point. We should avoid massive gathering, and together we have to collaborate to fight against the COVID-19. Thank you, Mr. Zhang Qiang, Deputy Group Leader of Testing of Beijing Headquarters for COVID-19 Response. And now I'd like to give the floor to Deputy DG and spokesperson from Beijing Public Security Bureau, Pan Xuhong, to talk about the readjustment of the regulation for people at entry and exit of Beijing. Good afternoon, friends of the media. After the outbreak of the Xinfadi wholesale market, in order to cope the further spreading of the COVID-19 epidemic from Beijing to surrounding areas and other regions, we have applied tightened measures on 4 types of people visiting the Xinfadi wholesale market, people are in close contact with Xinfadi wholesale market, people living in the medium and high-risk areas. For the majority of the residents, we recommend them not to leave Beijing, and for those people that do need to leave the city, they have to first go through a NAT. If they test negative, they could use a certificate to go out. And also the transportation authorities, including the civil aviation and the railway station, are collaborating with us. Altogether, we could help with the boarding of those passengers from Beijing while checking their certificate of the negative result of the NAT. Until now, we have tested 2.8 million passengers getting out of Beijing, among which 370,000 from the side of the civil aviation. And we have also persuaded people not to leave if they are not qualified. Currently, we have stabilized the situation. Judging by the daily reported new case, from the peak number 36, now it's to single-digit growth, especially in recent 3 days. Every day we have a number of newly added cases of no more than 3. 11 districts have 47 medium and high-risk regions. They have a close link with the Xinfadi wholesale market, and there's no further massive spreading of the coronavirus in the society. And for the NAT, for most of the positive patients, they are already under our observation, and very few are coming from the screening at the society level. On the basis of a 14-day medical observation, we have decided to prolong the duration of this quarantine for the other people qualified. By using those measures, we have lowered significantly the risks of the further spread of the COVID-19 in the society. With all the extraordinary measures, the capital city has cut off the channels of spreading of the virus, and the situation is under control. And currently, considering the needs of resumption of work and the need of traveling of the people, on the basis of ongoing strict measures on medium and high-risk areas, starting by 0 o'clock on the 4th of July, for people from the low-risk areas, they could leave the city freely without going through the certificate, without going through an AAT test. And I would like to say thank you for all the people that have collaborated and stood with us in the past period. But still, we have to notice that we are at a very critical moment, and we should not lower the bar down. And recently, we have noticed that some people, they have ignored the regulations and also tried to cover their trajectories or their close contact history with the Xinfadi wholesale market, or they have broken down the regulation for home-based quarantine, or they are spreading the virus and the risk. I'd like to give you the briefings about 4 other cases. Case 1, 41 years old male. He has visited the Xinfadi wholesale market on the 3rd of June, and later, together with his wife, his daughter, and his grandchild, he has close contact. On the 4th, he's been diagnosed as a confirmed case. And later, his family members have tried to cover the trajectory of this confirmed case. So this has caused the further spreading of the virus. Now we have put them under the criminal investigation. Case 2, someone called Wang, working in Xinfadi wholesale market, after receiving a notice for home-based quarantine, has refused to go for NAT, and during the quarantine time, he went out for work. And later on the 27th of June, he's been diagnosed as a COVID-19 case. And now, our authority has punished this guy for breaking the rules. Case 3, Mr. Xie, 38 years old. Since June, he has visited Xinfadi wholesale market twice. On the 3rd, he's been diagnosed as a Xinfadi-related COVID-19 case, and she has covered twice his trajectory related to Xinfadi. After signing the accord with the authority, he still went out for shopping and visits. He has broken down the rules, and we are punishing this case for the moment. Case 4, a couple. Before getting the qualification for giving the medical care, they have received 2 patients with fever and coughs, and they didn't report this to CDC. One of the patients has been diagnosed as a COVID-19 case in Beijing. Another was diagnosed at the hometown after leaving Beijing. And then at the residence of the couple, we have discovered a lot of medical facilities, and now they have been punished for their criminal actions. Everyone should shoulder their responsibility for collaborating with authorities, and everyone should follow the rules for quarantine at home and other requirements. It's not only your personal affairs, but also a responsibility as a citizen. For all those people that are not respecting the emergency notices, they could be punished by the authorities, and for those causing dangers to the society will be punished hard. I hope that all of you could carefully follow the rules, and together we could form a synergy against the epidemic. Thank you, Mr. Pan Xuhong, for your briefing. And now I'd like to give the floor to permanent member of Fengtai Party Committee and permanent deputy DG of the Fengtai District Government, Zhou Xingchun, to talk about the disinfection of the Xinfadi wholesale market. Friends of the media, good afternoon. People are caring about the disinfection and the disposal of the waste of the Xinfadi wholesale market. We are doing the disinfection and rearrangement of the environment under the guidance of the CDC and other relevant authorities. Everything is going on in an orderly manner. We have first set up the working plans, and then under the guidance of the experts, we have made detailed application plans. We have set up the routine for disinfection. We have the vehicles disinfection, firefighting regulations, disinfection of the goods, disposal of the goods, and also the emptying procedure of the warehouses, as well as the floor disinfection. We have mobilized more than 300 personnel for the disinfection. For a total surface of 960 square meter, we have made a large-scale disinfection. We have applied professional vehicles for disinfection with a capacity of 12 tons. We also have 15 vaporization vehicle. All the regions used in the disinfection are in accordance with the requirement of the experts. And we have applied more than 2,000 tons of reagents in the disinfection. We have regular disinfection twice per day in the Xinfadi wholesale market as well as the nearby environment. We are covering all the key checking points, key stands, as well as the vegetation bands. And we are also covering the major roads, streets, and the surrounding areas. We are also disinfecting the warehouses and greenhouses near the wholesale market. First, we will do the disinfection, and later we will do the rearrangement of the environment, and then we will repeat the disinfection, and finally we could have the disposal of the total wholesale market. On the surface of the objects and also the sewage should be treated. Secondly, for the disposal of the waste is almost completed. For the underground floor, the hall for beef and mutton, as well as the underground warehouse, has come to the end for the disposal of the waste. And for the waste, they are transferred by professional vehicles to the designated areas for a non-hazard treatment. As of 3rd of July, we have disposed 728 tons of meat and vegetables. Throughout the whole process of disinfection and management, we have asked all the workers to put on the PPEs, and we have also invited the firefighters to check for the security elements in the circuits of electricity, so there will not be any remaining risk for fires in the area. Every day, we have the standby medics to secure the whole working environment. The disinfection of the environment in the Xinfadi wholesale market is following the careful guidelines from the experts. According to the experts, we have carefully followed the regulations of the disinfection of areas, and we are about to have an overall evaluation of the results of the disinfection, and we believe that this terminal disinfection will be thorough and completed. Please don't worry about this wholesale markets disinfection. And now the floor is open for your questions. Please first identify yourself before raising a question. Thank you. I'm from Beijing Youth Daily. I have a question for Mr. Shi. During the NAT, we have the nozzle swab and the throat swab. What are the differences between the two? Do we need to go through both of them? First of all, I'd like to make a statement. We have the nozzle swab and the throat swab. If we work correctly according to the rule, then in nature there are no differences for the results, whether you are using a nozzle one or a throat swab. And there will be no difference for the diagnosis in the COVID-19. But for the throat swab, you will use the facility to swab in the throat, and for the nozzle one, you will put the facility inside the nostrils. So according to the two different ways of the entrance, we have different names. For the throat swab, the medics could have a clear sight of the area swabbed. However, this could give you a very difficult moment for the patient because it has some stimulus to the throat. But for the nozzle swab, we cannot see the inside of the nostrils, so it's more demanding for the medics, and the facility would be more complicated. And it's even harder for the patients. And sometimes, due to the stimulus to the dew area, there will be some body movement of the patient. This will have an influence or negative impact on the results. And due to the movement like the swallowing, this could also reduce temporarily the number of the virus in the dew area. Within 10 days of the infection, it's very efficient to use a throat swab. But after 10 days, usually the rate of the testing would be brought down. But usually it's not necessary to use both of the tests at the same time. I have a question. How much time does it take for one single case epidemiological survey, and while waiting, what should ordinary people do? Still, I'd like to give the floor to Mr. Shi Guoqing from the NHC expert team. For the epidemiological survey, after the outbreak of COVID-19, people become more and more familiar with this word. How much time does it take to complete one epidemiological survey? It depends on the status of the case and the complexity of their information. For some basic, fundamental epidemiological survey, usually within 3 to 12 hours. But for a completed epidemiological survey, we will mobilize a lot of people. We have to take a lot of samples, and finally, we even have to elaborate a report. According to the national regulation, now we have to complete the epidemiological survey should be completed within 24 o'clock because we are racing against the clock. So this means that we have to work day and night, and the patients should collaborate with us, and the workers at community levels as well as the volunteers should also join our work. By doing that, we could form a very effective synergy. Through epidemiological survey, we could know the basic information, the procedure, the process of developing symptoms, as well as the other contacts. Through this, we could also know the severity of the cases. For the severe cases, suspected contacts, suspected environment, contact history with the infected case, frequency, time, and place of the infection. For the people in the infectious period, before being put into a quarantine, their contacts and the environment and locations of the contacts should also be included. And for the cluster outbreaks, we should also calculate the number of people infected, the cause behind this event, and the infection pathways. The collection of all those information will be helpful for the further disposal of the dangerous products and the management of related population as well as environment. This is also in a very efficient way to maximize the protection measures and cut off the further spread of the virus in the society. This can also help to stabilize the society. But as we know, the epidemiological survey is usually retrospective. It requires a lot of patience. We have to communicate many times with the patient, and they have to recall all the details, as many as possible. We also have to take the samples when necessary. So it's a work of collaboration. Last question, please. I'm from Beijing Traffic Radio. I have a question for Mr. Shi. For the low-risk areas, why do we abolish that restriction for the people getting out of city? You can go out of the city without a NAT test now. As I have mentioned before, there are several reasons behind that. First of all, we have already contained this outbreak of Xinfadi wholesale market. For 5 days in a row, we have single-digit growth of daily reported new case, and since the 11th of June, we have completed more than 10 million samples of NAT. 5 districts have reported zero positive NAT, and for the other district, the ratio of positive result is also very low. Second reason, for areas without a report of a confirmed case, the risk of infection is very low. Low-risk area means those areas that have not reported a confirmed case for 14 days in a row. 5 districts are in this case in Beijing, and 10 districts for 14 days or more have no newly reported medium and high-risk regions. For 12 days in a row, we have not exported any confirmed cases to other provinces. Number 3, we have set up a joint prevention and control mechanism in the whole city. On the basis of the Beijing headquarters for COVID-19 response, we have completed our mechanism of work. We have set up a network of collaboration. All the cases and asymptomatic cases are hospitalized or put under medical observation. After the outbreak of the 11th of June, we have taken a series of precise and effective measures. We have basically contained the further spread of the virus in the society. All those measures of restrictions are working very well, and the situation has been stabilized, and the tendency is that we are improving the situation. Until now, it's been more than 1 month after it's been more than 1 round of quarantine periods after the outbreak of Xinfadi wholesale market. Number 4, while containing the virus, we should also care about the work resumption. Considering the regular mechanism for prevention and control, we also have to ensure the normal daily life for the people. Considering that, we have removed the restriction for people living the city for low-risk area. Thank you, Daddies. For today's press conference, you could follow our press conference in Weibo, Xinjing newspaper, Beijing News newspaper, People's Net, People's Video, Xinhua.net, Beijing Channel, CCTV News and CCTV Finance, official account, and China.net. Beijing Radio, Beijing Traffic Radio, Beijing News Radio will also give a live stream broadcast, and the news channel is also giving the live stream program of our press conference. I'd like to say thank you to all the people, our workers, and our spokespersons. Thank you.